Hi, I'm Dr. Betsy Bin. I'm a Senior Extension Associate at Cornell University and Director of the Produce Safety Alliance. Welcome to our COVID-19 training for fresh produce farms and packing houses. We will be covering basic information about the virus that causes COVID-19, as well as how you and others in your operation can work to minimize the spread. After this short video, there will be 3 quiz questions. You will receive an email of completion after submitting the quiz. Each farm and packing house employee has a responsibility to prevent the spread of COVID-19. This is important not only for individuals and their families, but also their coworkers and the entire food supply chain. Just as following good agricultural practices are critical to food safety, following proper control strategies to prevent the spread of COVID-19 is critical to the health and safety of all farm and packing house owners and employees. Coronavirus disease, or COVID-19, is a respiratory illness that can spread from person to person. The main way COVID-19 is spread is through respiratory droplets. When an infected person breathes, talks, sneezes, coughs, or sings, they expel respiratory droplets, which can expose individuals in close contact to COVID-19, thus spreading the illness. Although possible, the virus is less commonly spread by touching contaminated surfaces and then touching your mouth, nose, or eyes, where the virus can be introduced into the body. The key ways to avoid contracting the virus and spreading it to others are by practicing social distancing. This means staying physically at least 6 feet away from others. You also need to wear face coverings to prevent the spread of respiratory droplets. Next, you should self-screen for COVID-19 symptoms, such as coughing, fever, loss of taste and smell, or gastrointestinal problems, and stay at home if you are sick. It is always important to wash your hands frequently and avoid touching your face. The virus that causes COVID-19, SARS-CoV-2, is different from foodborne viruses. There's no evidence that SARS-CoV-2 is transmitted through food. Most foodborne viruses are non-enveloped, which means they have an outer layer of proteins that make them stable outside of their host and able to persist in the extremely acidic environment of the stomach. In contrast, COVID-19 is caused by an enveloped virus. In enveloped viruses, the protein coat is surrounded by a fat layer. These types of viruses are very unstable in the environment outside of their host. This means that even if one were to ingest SARS-CoV-2, the low pH of the stomach acid would likely inactivate the virus. To prevent the spread of the respiratory illness COVID-19, we must focus on ways to stop the transfer of the SARS-CoV-2 virus from person to person. We will now review ways to reduce the risk of person-to-person transmission with the primary goal of protecting your health in your workplace, your community, and your home. Using all of these strategies together is the best way to protect yourself. First, it is important to know that some people can spread the virus before they are even sick. This is called presymptomatic transmission. Some people will spread the virus and never experience symptoms. This is called asymptomatic transmission. It is important to stay at least 6 feet away from others when possible, even if you or they have no symptoms. Social distancing should be practiced on the farm and in the packing house at all times, including during breaks, when you eat, drink, or smoke. You should limit close contact with others outside your household and work crew as much as possible. If you must commute or work closely with others to complete certain tasks, always follow practices that reduce the risks of transmission. These include wearing a face covering, staying at least 6 feet apart whenever possible, keeping vehicle windows open to maximize airflow, and working in well-ventilated spaces as much as possible. It's also important to limit contact to those in your assigned work crew or cohort. Reducing transmission risks are especially important for people who are at higher risk for severe illness from COVID-19. Remember, stay at least 6 feet or 3 arm lengths from other people at all times, including when you are in the field, barn, or packing house. Avoid handshakes, fist bumps, hugs, or other social greetings that involve direct contact. Do not gather in groups. Stagger the use of break rooms or other common areas to maintain social distancing and reduce close interactions. Avoid playing sports with others outside of your household or cohort. Stay out of crowded places, especially when they are indoors, and avoid other mass gatherings in public or private venues. We've mentioned the term cohort several times. Sometimes working closely with others is unavoidable. Your cohort is all of the people you are exposed to in close proximity, whether it be at work or in your home, such as family members or roommates. The goal is to make your cohort as small as possible, since every person you're exposed to increases your risk of COVID-19 exposure. If you must work closely or commute with people, make it the same people as much as you can. Make sure everyone in your cohort knows how to reduce COVID-19 risks because their behavior impacts your risks. This includes your work crew and your family members. Social distancing and mask wearing are the most important steps to take, as individuals may unintentionally spread the virus if they are not currently showing symptoms such as being asymptomatic or pre-symptomatic, or have very mild symptoms that they do not know are signs of COVID-19. Wearing a face covering with 2 or more layers helps to stop the spread of COVID-19. Remember, you can spread COVID-19 to others even if you do not feel sick. This is one of the reasons that the CDC and health organizations around the world have recommended face coverings. Face coverings are not a substitute for social distancing. However, the cloth covering is a tool you can use to reduce risks for everyone. A face covering must be worn properly to reduce the spread of COVID-19. To correctly wear a face covering, wash your hands before putting on your face covering. Put it over your nose and mouth. It is very important that it cover both your nose and your mouth. Try to fit it snugly against the sides of your face and under your chin. Make sure you can breathe easily. Avoid touching your face with unwashed hands after putting on the face covering. This is why it is important to find a face covering that fits well and is comfortable, since it will limit your need to touch your face to adjust it. Wearing a face covering is not a replacement for social distancing. In order to reduce the risk of transmission, practice social distancing and wear face coverings in the workplace and in the community when you are around others. Here's why you need to wear a mask properly. The highest risk of becoming infected is when face coverings are not being used or being used improperly, and someone with COVID-19 comes into close contact with another person. This is because there is no barrier to prevent the spread of respiratory droplets coming out of the mouth and nose from an infected person, and the uninfected person's mouth and nose are completely exposed to the respiratory droplets. When an uninfected person wears a face covering properly, they are more protected when they come into close contact with an infected person who is not wearing a face covering. It is even more effective when both individuals, the person who is COVID-19 positive and the uninfected person, are wearing face coverings when they are in close contact. And since you do not know who is actively spreading the virus at any time, it is important for everyone to always wear a mask when they are out in public. The lowest level of risk is when both individuals are wearing face coverings and they are standing 6 feet or more apart. Remember, wear a face covering correctly, covering both your nose and mouth. Avoid touching your face covering with your hands. Wear face coverings whenever you are in public or near others. Follow your farm or packing house's policies and procedures for wearing face coverings at work. Wash your cloth face coverings after each use. Just like we do as part of proper personal hygiene and good agricultural practices, wash your hands often with soap and water for at least 20 seconds, especially before putting on gloves or after changing work areas or after blowing your nose, coughing, sneezing, smoking, eating, or drinking. Hand sanitizer is not a replacement for washing your hands with soap and water. Hand sanitizer is only recommended when soap and water are not available because it is not effective on soiled hands. Although hand washing has always been a good agricultural practice to prevent the spread of human pathogens to produce, it is more important than ever for your health and the health of others in your work areas. Remember to wash your hands before putting on a face covering, starting work, putting on gloves, taking a break, preparing food or eating, smoking, or touching your face. And after, your shift ends, using the restroom, taking a break, eating, smoking, sneezing, blowing your nose or coughing, touching your face, using your cell phone, using shared equipment and supplies, or putting on, touching, or removing face coverings. And anytime your hands have touched a surface that may be contaminated or is visibly dirty. Always follow your company's policies and procedures for proper hand hygiene. The virus can enter the body through the eyes, nose, and mouth. To limit the risk of contracting the virus, it is important that you do not touch your face with unwashed hands or dirty gloves. You should also be careful not to share items that come into close contact with your face, such as cell phones, water bottles or cups, food utensils, or used cloth face coverings. In addition, make sure you clean and sanitize shared equipment, tools, and vehicles between uses. We focus on cleaning and disinfecting frequently touched surfaces as well as hand washing to reduce the risk of transmitting the virus from a surface. However, surface transmission is not the main source of spreading the virus. As mentioned previously, the main source of COVID-19 transmission is from person to person through respiratory droplets. You may have heard sayings about leaving home issues at home and work issues at work. The virus causing COVID-19 does not play by those rules. What you do outside of work can have a big impact on the health and safety of your coworkers. This is why it is imperative that you follow social distancing and face covering guidelines in your personal life, as well as in your community and at work. We specifically recommend that you continue to avoid large gatherings and make an effort to avoid exposure to others outside of your household or cohort. If you or someone within your household have been potentially exposed to the virus causing COVID-19, it is imperative that you inform your employer and isolate from family members who have not been exposed. Because of the nature of the virus, what happens to you outside of work can impact everyone else in your workplace. This is one of the reasons why employee screening is important. Your employer may implement screening policies to protect you and your coworkers and to prevent the spread of COVID-19. These could include practices like a symptom questionnaire and temperature checks. If you have any symptoms, stay home and reach out to your primary care provider. If you have been in close contact with someone who has tested positive for COVID-19, inform the management of your farm or packing house and implement isolation practices at home to protect your family members. Make sure you notify your supervisor if you experience any of the following symptoms: a fever of 100.4 or more, chills, cough, shortness of breath, chest pain, out of the ordinary tiredness, bluish lips or face, muscle pain, runny nose or nasal congestion, sore throat, loss of sense of smell or taste, or gastrointestinal problems. It is important to be honest with your employer when being screened for COVID-19 and to report potential exposure to people who have tested positive for COVID-19, even if you do not have symptoms. Check with your employer to understand new sick leave policies related to COVID-19. Do not go to work if you have any symptoms of COVID-19. Each individual in the food industry is responsible for preventing the spread of COVID-19. Encourage your peers to follow your farm and packing house's new policies and procedures on COVID-19 in the workplace. Be open to new and changing policies as more information about COVID-19 becomes available. As vaccinations are administered, your farm or packing house management may modify these requirements. By following these steps, you can contribute to a healthy environment. Follow social and physical distancing guidelines. Wear face coverings correctly, covering your nose and mouth. Wash your hands often and avoid touching your face. Be responsible at home, in your community, and at work. Report COVID-19 symptoms or exposure. COVID-19 has caused us to do many things differently in order to keep essential workers and their families safe. Please follow guidelines issued by the CDC and your employer to maintain a healthy work environment. Here's a review of what we've covered in this training. The main mechanisms of COVID-19 transmission is from person to person through respiratory droplets. There is no evidence that COVID-19 is transmitted through food. Use prevention and mitigation strategies to control the spread of COVID-19. Practice social and physical distancing guidelines. Wear face coverings correctly, covering both your nose and your mouth. Wash your hands often and avoid touching your face. Report COVID-19 symptoms or exposure to your employer. Understand the importance of employee screenings to reduce the spread of COVID-19. Be responsible at home to minimize the community spread of COVID-19, and embrace and contribute to COVID-19 control culture. As vaccinations become available, consider getting vaccinated for your own protection, as well as the protection of your family, your community, and your workplace. Thank you for listening to this training.